Today we're going to talk about augmentation, breast augmentation. It's one of the most common procedures performed in plastic surgery in the United States and around the world. It's a very, so to speak, simple, short procedure. All surgery is significant, and no surgery should be considered just a trip to the spa or anything like that. It should all be approached very cautiously and with a lot of research by you as the patient, so that you know exactly what you're getting into. But this is one of the very typical ones. So I'll kind of give you an overview of what's involved with the breast augmentation. So breast augmentation specifically addresses adding more fullness to the breast. So whatever the breast is starting at, basically the shape of the breast, positioning of the breast, any asymmetries that are there, that is essentially going to stay after a breast augmentation. All that implants do is make the breast that are currently there larger. So that's an important concept to know going into a breast augmentation. If there are lots of different size discrepancies or different degrees of hang of the breast or anything like that, then that's where we would be talking about a breast lift. So those are things that are important that we would talk about in a consult. When I would do the physical exam, I would point out to you if there's some limitations to the procedure of a breast augmentation alone. For the augmentation part, the most kind of important part to know are the implants that are involved. Two basic types of implants, and you would get to feel these in the consult and kind of see what you think. It's kind of funny to watch the husbands when they are addressing this issue, because they are always very interested in feeling what these feel like. So there's saline, which is a silicone shell and filled with saline, which is just what's in an IV saline bag like you get when if you were to go to the hospital or something like that. Has a little fill port on the top, and that's how we fill it up at the time of surgery. And then there's a silicone implant, which is also a silicone shell filled with a cohesive silicone gel. You may hear the term gummy bear. It's not truly a gummy bear implant, but a lot of people will call it that. I'll show you a gummy bear in a minute. But it's a more cohesive gel. It's kind of like those little sticky hands that kids get out of like the quarter machines or whatever and you play with. It's that kind of consistency. So if you were to cut this, it's not going to just ooze out. It's going to actually basically stay in place like a little bit slimier version of a gummy bear. There's not a best implant. There's some pros and cons and differences. So a silicone implant is going to have the most natural feel. It's going to show less rippling along the edges because of what it's made out of. Whereas a saline implant is going to be a little firmer because it's basically a balloon, and it's going to show a little more rippling along the edges. If someone has plenty breast tissue that covers the implant, then in that case, kind of those pros and cons are really irrelevant, and they're not really going to appreciate that. However, if their breast tissue is thinner, then they're going to probably like the feel and the look of the silicone better. There's about $1,000 difference in price between the two. The silicone's a little more expensive. The saline is nice because if it ruptures, it's just going to go flat. You'll notice it very apparently, and your body will absorb the saline, and then you will pass it. So just very simple process. You come in, change it out, very simple. Silicone, you won't necessarily know if it ruptures because it is a cohesive gel. So because of that, the FDA recommends an imaging test like an ultrasound or an MRI. The very specific recommendation is for an MRI. And they'll say at 3 years after surgery and then every 2 years after that. That's to check to see if it ruptures. So that's one kind of difference to be aware of between the two, between a silicone and a saline. Otherwise, it's the feel thing. It's ultimately up to you. I'd give you some options, kind of give you my thoughts on that, but ultimately you would decide on what you want to do on that. There is a third option, and we'll kind of talk about it more and some real specific things with that in another video, but it's a shaped implant. I used to love these implants in the right person, and just the general population across the board, it doesn't always make a benefit, but in certain patients it can give a really nice look because it really gives that nice teardrop shape. But this is a textured implant, and there's some issues. You may have read some things about ALCL. It's a rare form of lymphoma. So in another video, I'll talk to you about that. We're not using these much anymore, but a lot of people ask about this, so we'll kind of give you some updates on that. Otherwise, should you be scared of silicone? That's a lot of things. No, you should not be scared. There's been many, many studies saying that it's very safe. It's a very inert material. But it is just something to be aware of. You're putting a foreign body in your breast, and so that's has some things to consider. the rupture rate is about 20%. So by 10 years, 20% of the implants will have ruptured. It's a little higher for saline than it is for silicone. Nothing to be scared of, but just to know that this is not a once and done kind of thing. You're probably going to need to do something with this again in the future. If they're fine, just leave them alone. You don't need to change them out every 10 years. Some people think that. That's not true. Just leave them alone. And then if something were to happen, then you could address it at that point. So that's kind of the expectation from that regard. Another thing to know about is a thing that you may read online now. So breast implant related illness. It's kind of a very vague, gray area thing that we're learning a little bit about. It does have some credence, and I actually do know a patient that had it before, but it is something that's very rare. If you go online and read about it, you're going to think that everybody has it, and you need to go to this specific surgeon that specializes in taking them out. Well, that's just marketing, and they're making a really nice living off of some people's gullibility. So I'd be very cautious with that. But that's not to say this isn't a real thing. It is a real thing. Some people have it where they'll have rashes, they'll have fatigue syndromes. It's kind of a very vague symptom presentation. But I do know a particular patient, a very credible patient, that was having these after having implants put in. She had them taken out and it resolved. So it is a real thing. It's an extremely uncommon thing. But it's something that you may read about, and we can talk further about that at some point in a consultation if you had any further questions on that. But definitely something that's uncommon and not something to get very concerned about. So that's the implant side of things, filling the breast out. We typically put it under the muscle. You can go through 3 incisions, inframemory fold, which is in the crease. It's just a 3-centimeter incision. You can go peri-areolar, right around the areola, or you can go the armpit or axillary incision. My preference, along with most surgeons, is the inframemory fold incision. It's very small. We measure it out right at 3 centimeters. The nice thing about it, it's right where we need to go to slide right underneath the muscle, so we don't do any damage to the breast tissue. It has the lowest rates of infection, lowest rates of capsular contracture, which is a scarring that can occur around the implant. Your body makes a capsule around the implant. That's totally normal, but about 3% of the time you could actually get a scarring that occurs. It's not harmful to you, but it just doesn't feel right or look right, and you would possibly want to come back and get that removed. So by going in the inframemory fold incision, it's much, much less. Going through the areola can heal really nicely, so that's why some people like to do that. However, it does have a little higher rates of infection and a little higher rates of capsular contracture. And we go all the way through the breast tissue to get down to the muscle, so we potentially could cause a little scar tract or distortion of the breast tissue. The axillary is nice because it technically hides the incision. However, it can be very imprecise in placement. We do it bluntly rather than very visually and with electrocautery, so it's kind of, for lack of a better word, tearing open that subpectoral pocket. And so there can be a little issues with placement of the implant. So by and large, we like to do the inframemory fold incision. Then we place the implant under the muscle. The reason for under the muscle is because it decreases capsular contracture rates, that scarring. It also holds up a little better. It creates less visibility of the rippling along the edges if that were to be something in a very thin patient. So those are all reasons that we prefer that placement of the implant. As far as sizing, that's the thing that's very subjective. We're trying to do everything we can to get the size that you like. I'm not a huge believer in the imaging things. I tried it out for a year one time and then decided to do away with it. I think it gives unnecessary and imprecise post-operative result for what you're expecting because it's a computer-generated image. So I just chose to decide that it wasn't appropriate for me, for patients. But we'll do things. Talking helps a lot, just kind of getting your ideas. We'll have you bring in pictures that show me a lot what you're thinking in your head. We'll do sizing with silicone inserts that you'll do with our medical assistants at the pre-op appointment and really see what that looks like on you. And then actually during surgery, I'll put temporary implant sizers in you that are adjustable, and I can fill those up or down and see exactly what that looks like in you. I'll take those out, and then I'll put the final implants in. We have all the implants for 2 different companies on the shelf. So we can just basically pull exactly what you want. They come in all different sizes of volume and all different diameters. And that's another point as well. A lot of people think that they need to decide on what profile they want. Oh, do they need a moderate plus profile or a high profile or an ultra high profile implant? Really, that's kind of a misconception. That's basically for the surgeon to decide how to fit that in you. If you have a really petite person, that wants a larger implant, then that person is going to use a more narrow profile or a higher profile implant so that you can accommodate that volume in that person. If you have someone else that's taller and has a wider shoulder width, then that person, say they want the same volume, that person needs a less high profile implant with a broader base so that it fits perfectly within their breast. You want it to fit the footprint of the breast. So that's where the profiles come from, so that we can adjust it correctly to fit your goals and what you're desiring in that regard. The surgery itself takes an hour or less for breast augmentation, so it's fairly quick. Typically done under general anesthesia with a board-certified anesthesiologist. And then you spend some time in the recovery room. You come back and see me the next day, a week afterwards, 6 weeks, 3 months, 6 months, a year, and yearly if you would like. Most people, it's fairly sore that first week because it's stretching the muscle, so that's where the pain comes from. After the first week, it's mostly just kind of a tightness at that point. Most people would take about a week off from work, but there would be restrictions for 6 weeks, so no real heavy lifting, rapid arm motions, cleaning the house, vacuuming, all of that sort of thing. Being very careful picking up kids, that's one of the things that can really get you. Even out a few weeks, sometimes we could get a hematoma for something like that. So that's what we're trying to protect against, is having bleeding, because we don't want that to affect your ultimate post-operative result. We'll give you a surgical bra that you'll wear for the first 6 weeks. That allows the implants to settle down into place so that they don't end up sitting too high, because we want them to stretch appropriately into the breast. But that's kind of the concept with a breast augmentation. The incision, super simple, super small, sutures that dissolve. You won't have to deal with that again. But a great procedure to fill out breast volume, whether it's from a situation where you just never had much breast volume, or if it's after having kids and you've lost a lot of breast volume, or if it's just you want larger breasts. That's all can be treated by a breast augmentation. So hopefully that was helpful, giving you some overviews. If you have any other questions, always feel free to give us a call. You can talk to me, you can talk to my patient coordinator, Robin, or if you'd like to come in for a consultation, we can definitely talk specifically about you and give you some thoughts on what I think would address the issues that you have. So hopefully that was helpful. Have a great day.